Are you pregnant and wanting to avoid tearing during delivery? Well, stay tuned because I'm going to teach you how to avoid tearing during childbirth. Hi, I'm Dr. Brenda Heinecke, and I'm the owner and pelvic floor physical therapist at Revitalized Physical Therapy. And I have worked with hundreds of women over the years, teaching them these exact same techniques. So make sure you stay to the end and catch my favorite tip of all. Number one, we want to relax the muscles during crowning. So on the pelvis here, these pelvic floor muscles, we want to try to lengthen and relax. So as crowning and getting to that point, it can be really painful, really intense. And so the best thing you can do is try to take a deep breath. Breathe, try to relax all of your muscles. Don't clench your jaw, don't clench your fist. Try as best as you can to think of relaxing all of your muscles, the pelvic floor muscles, and your legs. My second tip to avoid tearing during childbirth is to consider skipping the epidural. Now, this is completely a personal choice, but with an epidural, research has shown that you have a higher risk of tearing and more severe tearing. The reason being is that you can't feel those muscles. So if you do opt for an epidural, see if you can get kind of like the bare minimum where you can still feel everything is not completely numb. And then this way you can still feel that pressure and still feel when you need to push and when you need to back off. Or consider just going without it and trying to do natural pain management. So again, completely a personal choice, but this can really help avoid tearing. The third thing you can do is consider working with a pelvic floor physical therapist. What we're going to do is actually release these muscles here. So this is your deep pelvic floor muscle. And what we're doing is trying to lengthen and stretch those muscles so that they can do that during delivery. Ideally, you want to start this by 34 weeks pregnancies, and they'll also help teach you how to effectively push so that the muscles are lengthening and stretching while you're delivering and not tense, tight, or contracted. Another tip to avoid tearing during childbirth is to listen to your birth team. So it can be really hard to take a minute to just relax, slow things down, especially at the end when everything is getting really intense, painful, there's a lot of pressure. But listen to them. They might tell you to pause or try to just hold it there to let everything stretch. They might even tell you to take a breath, breathe, anything like that. Try to listen to them. They can see what's happening. They know what's going on with the tissue, and they're gonna help guide you the best that they can to avoid tearing and try to minimize any trauma. So keep that in your head. I know things happen, but try your best. And lastly, my favorite tip to avoid tearing is to avoid pushing on your back. So when you're on your back, the pelvis is sitting in this position here. And research has shown that this position actually can increase tearing or increase the severity. We want to try to get into a gravity assisted position. So this is anything that is going to bring the pelvis a bit more upright. So this would include using the squat bar, even going on hands and knees. You might even go into a low squat. Anything that avoids this. If you do have an epidural, this can be a little bit tricky because you might be more limited. So this can be where going onto your side or sideline, or even just trying to prop up your back and head so that you're not completely flat and you're a bit more reclined. Any of that can help minimize that tearing and just allow gravity to do more work so that the pelvic floor muscles can stay relaxed and minimize trauma. So I hope that helps. If you found this helpful, I would highly suggest checking out our other video on perineal massage, and let me know what you think in the comments.